Welcome to Continuum, a podcast from the New York City Mayor's Office of Community Mental Health. We are a unique office proud to work across multiple sectors and leverage all parts of government to promote mental health for all New Yorkers. We believe that mental health is health, and it's essential for every New Yorker, whether we are healthy and thriving, coping and mentally surviving hardship, or dealing with a mental health crisis. Our office coordinates citywide policies and strategies to fill critical gaps in mental health care, ensuring that every New Yorker has access to the support they need.
In this podcast, we are going to dive into the multifaceted world of mental well being, exploring the innovative strategies and dedicated efforts to shaping a healthier New York City with leading experts, community advocates, and individuals with lived experience. All working to ensure that every New Yorker has the support they need to lead healthy, fulfilling lives.
Hi, I'm Simone Watson, Senior Director of Mental Health Access and Crisis Response at the Office of Community Mental Health.
And I'm Dr. Nivea Jackson, Senior Manager of Community and Workforce Initiatives at OCMH.
We'll be your hosts for today as we navigate the diverse landscape of mental health from prevention and early intervention to treatment and recovery.
For this episode, we're excited to welcome Natasha Edwards, mental health counselor at E.S.P.Y, Elmhurst Suicide Prevention of Youth at Elmhurst Hospital Center.
We also have Hina, Program Director at Caring Transitions, Elmhurst Hospital Center. Thank you both for joining us today.
Thank you.
Thank you for having us.
Thank you.
Natasha, can you tell us a little bit about the origins of E.S.P.Y and the need for a program such as this?
Sure. Sometimes I feel I can talk about our program every day, all day. But just to give you guys just a brief synopsis, so E.S.P.Y, SP, we have various pronunciations of our program, but we stand for Elmhurst Suicide Prevention in Youth, as you mentioned, and we are an age grant funded program that offers free workshops and services to schools, community based organizations, and agencies across the entire borough of Queens. Yes, Queens is our catchment area, but we've been in Manhattan, we've been in Brooklyn because mental health does not restrict to one borough. So a little bit more about us. We host workshops not solely for youth, but for parents and staff from organizations and agencies who work with youth because it's important understanding that these are the caretakers of our youth, of our future. Our mission is quite simple. We are a small but mighty team. We consist of both clinicians and non-clinical staff like our peer counselors and our community health workers, patient navigators, who we're just focused on reducing the risk of suicide for youths in Queens. We have a shared vision to engage in prevention efforts across a multi-level, about 3 tiers, given our actually approaching in an interdisciplinary scope. And this is really a community-based model. So biopsychosocial, ecological framework in working to create a culture to destigmatize suicide, prevent suicide and mental health, and to empower our community. I can share about me just a little bit.
Sure.
Not for too long. My transition to this side of prevention, I actually prior to this was working at Family Court doing prevention, getting the fact cases, and I thought about how can I continue prevention work before they get to me at Family Court, before I have to go into the home and do family therapy. And I heard a little bit about this program, and I heard the stats, and I realized how important it is that we can reach our community before they come to us. Now, if they come to us, they're going to get an amazing level of care, New York Health and Hospitals. But we want to come to your door. We want to come into your home. We want to sit and have coffee like we're sitting here. We want to talk about mental health. We want to talk about suicide prevention. And as much as I actually get eager to speak on the stats, I also get saddened because I have to share that suicide is the second leading cause of death for our youth aged 10 to 24. I have to I have to share with families and my community that you that identify as racial or ethnic minorities or sexual or gender minorities have elevated risks of suicide. I have to share this. And that's the reason I and our program exists, because we are here going into communities, our marginalized communities. We are focused on BIPOC and LGBTQ youth, and speaking of how unfortunately youth residing in Queens have some of the highest number of suicides, both and females. And we're here to truly elevate, and hopefully I can share more on the work that we're doing in various workshops, etc., and our holistic approach to suicide prevention.
Absolutely. That sounds amazing. Thank you so much for sharing that. And Hina, how is this different from Caring Transitions? And how do you guys work together?
Yeah, thank you for that question. I think some of the similarities are both our programs are, obviously suicide-centered, youth-centered, multidisciplinary teams. Both prioritize care regardless of immigration status, insurance status. I think the key difference lies in a lot of the focus for SP is preventive, workshops, education. Caring Transitions gets involved when someone has gone through a very acute crisis, when youth finds himself in a hospital for either a suicide attempt or for some serious suicidal behaviors. That's when these kids get flagged for us, for our team. And the way we work is we offer support for 90 days. The first 90 days following a suicide attempt or serious suicidal behaviors are the most extremely vulnerable and high risk time period for the youth, because the factors for a reattempt or a relapse are the highest at that point. Also for caregivers, the families that are involved, there's a lot of fear, a lot of confusion, a lot of why did this happen? How did this happen? What could I have done? So the supports that the Caring Transitions team offers includes a social worker that does like monthly assessments. We have a youth peer advocate who has multiple encounters with the youth, as well as a family peer advocate who's able to offer a lot of support to the caregivers. And the key is to sort of use these interventions to mitigate the risk factors, to decrease the risk factors for the reattempt, to be able to meet the families, the youth in the community, in the home, in our office, to do these interventions and have as many conversations as we can about what led to this point and how we can move forward. We found that the more we talk about it, the more we express our concerns and our fears, the lighter the load becomes for our families to carry. And they see that they're not alone in this. And the unique thing about our program also is that, our youth peer advocates and our family peer advocates have that lived shared experience that they can talk to the families about and kind of be like, I know how you feel. I've literally been where you've been. So, it really supports the families in learning how to move forward. I'm sorry, the second part of the question I didn't answer. And how do we work together is often all these lovely workshops that, Natasha spoke about. Once our youth graduate from our program after this 90-day period, we're able to link them and tell them about E.S.P.Y and tell them about all these like workshops they have, the interactive programs that they have, and they often continue to follow up with the supportive care.
Very important information. And at the mayor's office, we believe that every New Yorker deserves access to quality mental health supports that understands their unique lived experiences. So thank you so much for talking about that. And can you just elaborate on how does Caring Transition support the mental health needs and challenges faced by youth and their families in the Bronx and Queens?
Yeah, absolutely. So as I talked about the youth peer advocates and the family peer advocates, I think they play the most essential role in the work that we do. The multiple encounters that our youth peer advocate has with our youth, these are very youth-centered. They work on coping skills, they work on advocacy skills, they work on whatever it is that the youth wants. Sometimes it's something as simple as just taking a walk around the park and being with someone who can kind of hear them and be with them in that space. For our family peer advocate, the work is also very concrete and palpable in the sense that often our caregivers don't understand some of the nuances that that come with being connected to care, that come with the mental health system. So our family peer advocate is able to physically go with the parent to an intake appointment or go with the parent to get insurance for the first time, accompany them for these concrete things that come up. So that's one way. And also our social work assessments that happen, again, either in our office or in the community, kind of talk about the suicidal risk directly. So we do a lot of assessments and screenings that partake to suicidality. We do an SIQ assessment, which again talks about suicidal risk factors. And the more we talk about it, the more we address it, the more we focus on it, the easier it becomes to talk about.
Thank you so much for that.
Natasha, circling back to you, E.S.P.Y seems like a program that exists more upstream on the mental health continuum. From the perspective of the Mayor's Office of Community Mental Health, we recognize that community is a backbone of resilient mental health ecosystem. Can you describe how E.S.P.Y engages the community around youth suicide prevention?
Yeah, sure. So many layers, so many things. I want to comment, we just had our second annual block party.
I saw that.
Yes, on the 6th, and we're still counting, but right now we're over 1,300, and
Wow.
this year having about 700, and continuing to grow, continuing to have organizations want to come out and be at that event to talk to our community about being a bridge to their care, being a bridge to support them, and to truly understand that it takes a village. It takes a village, a community to come together. So I mentioned earlier about our 3-tier system. So just to touch a little bit on that, how we're engaging our youth around suicide prevention, how we're engaging our community is our program is truly focused on a 3-tier system. And the first tier is that universal community-based outreach. So we are focused on educating the youths. We are focused on educating the families and the communities around suicide rates, around risk, around warning signs, around prevention and resources. So we are going into the community, we're going to schools, we're actually at various high schools where we're spending the day there providing environment. We're going to like the Department of Mental Health and Hygiene and speaking to their directors. We're going into churches on a Sunday or a Saturday and speaking to the clergy members and the congregation. We're actually hitting the ground and we're going to have that conversation. I'll provide a coffee, you just show up. I'll provide. So we're meeting them where they're at. Truly, when we think of care, person-centered care, and that approach is meeting our community where they're at. So if you want to sit on that park bench, I would sit on the bench with you, and we will discuss how can I support myself, how can I support my family. So that level is truly that those workshops will be geared around, let's say, our mental health one-on-one. It will be geared around one of our suicide prevention trainings, which is the Be Sensitive, Be Brave. It's a cultural, interactive, infused approach towards suicide prevention. Then we have our tier 2, because we're levels and the multiple levels. Tier 2 is that early identification. So we're doing the screenings for suicide and wellness. We're doing support activities. So we're identifying youth that are at elevated risk, and then we're providing these wellness and supportive activities. So this could include you coming to our site and doing Tai Chi. It could include you leading a self-portrait painting activity so you can explore your identity and who you are. It could be us doing a trigger and anxiety workshop, helping you to identify your triggers and how then do you cope. So we have that aspect as well, but it also includes us doing screenings and educating you on that. Then we have the third level, which is the utilization of our crisis services, our mental health services for anyone, acute care. And this is really, in essence, us connecting someone that behavioral response. So it's connecting our youths at high risk for suicide with crisis management, and not just our youth. So no man get left behind. So even if it's granddad, if it's mom, auntie, the neighbor, no one is going to be left behind. We're really there engaging them either in family therapy, group therapy, individual therapy. And I think one of the benefits of our program is just like Hina highlighted, we have the multidisciplinary. So we have clinicians, myself and our program director, clinical staff, and we have the peer counselors with the lived experience. We have our patient navigators who are going to connect you with insurance support. We're going to help you with housing support, whatever support you need. And we have a community workers who are building those partnerships. So going into the meetings and asking, how can we help you? What can we do? So we've noticed that that has been very beneficial in supporting our community. And it really takes a village. I cannot stop saying that it takes a village. We have the support of our leadership, continued support, and we are showing up hand in hand, just chanting, there is hope. There is hope for everyone, and we're hoping to continue to do that work. So that is something that, you know, we continue to learn and grow with. So we understand that cold calling, it may take a while. We're going to make those phone calls. We're going to show up at your door and ask you how. We're going to meet you on your timeline, because we understand that if your mental health is not at that optimum place, then you're not going to succeed and excel. And our goal is to truly help everyone to be the best version of themselves. So we're showing up in any way and every way possible. So you're going to get the calls, you're going to get the emails, we're going to sit with you. And one thing I want to highlight, we truly value, and I share this with the team and even with my students, we value that in showing up for someone, you understand that their values, their beliefs, and their cultures are the core of who they are. So us respecting that, understanding that, and taking that approach that we're going to meet you where you are means that we also have to give you the space and time, but letting you know that you have the support and we're in your corner.
Thank you so much, Natasha. And showing up is extremely important. So thank you for that. So for youth and their caregivers listening today, or anyone who wants to support the mental well-being of youth across the city, what is one key advice you'll offer or one action they can take?
Oh, I can say so much to this. I would say pour into your bucket, because we understand that an empty bucket cannot support. So understand your mental health and well-being. Be okay with it. Your mental health matters. Your life matter. And then I want you to extend and share that light. So we're hoping through the work that we're doing that, you know, that we encourage and empower others to pour into themselves, take care of themselves on all the different layers, and then to share that light with someone else. Truly echoing our mission of there is hope and everyone and every life does matter. And just to put a very shameless plug, you can reach out to us as well at Elmhurst, aspire at nychhc.org, and we will provide that bridge to care and that support in any way possible. And if we can't do it, we are not ashamed to connect you with someone that can, because it takes a village and we're in this together.
Yeah. Plugs are definitely welcomed as long as they're resources that are much needed for the community. So building on that, where do you see the most impactful opportunities for city agencies like ours, community organizations that work directly with NYC youth, and individuals to collaborate even more effectively to improve mental health resources for youth? Are there any consistent themes or lessons that you learned through your varied work that you can share?
Yeah, I think that just the fact that we're here and we're talking about this, and there's so many programs that are out there now talking about mental health, is a huge difference than when I was a kid in school. Like, these things are never talked about. I was an immigrant to this country, and although I spoke English, often folks thought that I didn't because I was so quiet. And I've seen that this is like a common theme that comes up in a lot of the immigrant families that we serve, is this need to just be quiet. So when we have these programs, when we have these conversations, these collaborations, I think it just speaks volumes to the work that we've done, but also highlights that there still is a lot more work to be done. As we're linking our families and our youth to clinics, or seeing them being already connected to clinics, there's tremendous long waits. There's folks that are unable to even get connected because that language barrier is there. Like, there's clinicians that don't speak the language. And so I think that it's crucial for our city organizations, our community organizations to recognize the value in retaining bilingual staff, training bilingual staff, and providing that support for the community that we serve, because representation really, really matters a long way. I think also additional support is needed for youth in multiple different, obviously for mental health, but also like additional diagnoses such as eating disorders, substance abuse. That is lacking significantly when we're doing the work and we're doing the linkage. And I think I love the fact that we're in schools. I love the fact that we're having these conversations. There's school-based clinics that didn't exist before. They're there now. E.S.P.Y's there in the community doing this work. I think we need a lot more though. I love the fact that we're in churches, but we also need to get into mosques and temples and libraries, because I'm noticing in the work that we're doing that most of our families are immigrant families, and most of our families are Latino, Spanish-speaking families who are agreeing to be part of our program and are agreeing to the services, but there's still significant stigma and shame attached to needing that support. And when we talk to other families that come up for us, like South Asian, Jamaican, Haitian families, there's a strong resistance to getting involved. There's a strong resistance to getting that support. And again, it's part of destigmatizing mental health and specifically suicide. I can't count how many times I've heard in different languages this phrase, what will people say? What will people think? So there's this shame and this thought process that, people will think less of us if we need the support or if we need to address these things. That definitely needs to be tackled more. And we're getting there. We're continuing to have these conversations. We're continuing to collaborate. There's already, as I said earlier, significant change from when I was a New York City public school student to now. So I appreciate these forums. I appreciate these formats, and these conversations just need to continue.
Definitely.
I definitely agree. And I do want to say thank you so much to the both of you for sharing your insights and the incredible work of both Caring Transitions and E.S.P.Y from New York City Health and Hospital, Elmhurst Hospital Center. Your dedication is truly making a difference for youth and their families across Queens and the Bronx. And thank you for our listeners for tuning in.
Yes, so for more information on initiatives supporting youth mental well-being in New York City, please visit the Mayor's Office of Community Mental Health website at nyc.gov at / mental health, and follow our Instagram and LinkedIn profiles. Thank you so much, guys, for joining us. Your information is so valuable, and we wish your programs the most success.
Thank you. Thank you for having us.
Take care.